Have you ever hurt yourself? Not in a fall down and scrape a knee way, but hurt yourself to the point where the pain interferes with your daily life? Maybe you lift something heavy at work and you find your back just won't stop aching. Or maybe every time you sit at your computer to type, your arm gets tingly. For many people, when they have a persistent pain, reaching for the closest over the counter medication, such as Tylenol, ibuprofen, or Aleve, is the first thought that runs through their mind. I mean, it gets rid of the pain, right? But what happens when the pain becomes chronic, as in persisting for more than 3 months? Is physical therapy one of the first options you think of to get rid of your pain? Probably not. According to the CDC, sales of prescription opioids have quadrupled in the United States, even though there has not been an overall change in the amount of pain that Americans report. So if you're currently experiencing pain or have in the past and you resort to medication, I'm here to tell you that there's a better way. I'm here to persuade you that physical therapy is more effective than medication and should be prescribed before it. I first want to talk about the benefits of physical therapy. Unlike medications or opioids, physical therapy targets the direct root of a problem instead of just masking symptoms. Physical therapists and physical therapist assistants use modalities, which are medical equipment, to help relieve pain and improve symptoms. Two of the most commonly used modalities in physical therapy clinics are ultrasound and electrical stimulation. Ultrasound emits sound waves that heat deep tissues. Those sound waves improve blood flow, help muscles heal, and they even help heal broken bones. Electrical stimulation can help the body in ways such as relaxing tight muscles, strengthening weak muscles, and even reducing pain. Between the use of just these two modalities, many of the most commonly seen pathologies in physical therapy clinics can be treated. The American Physical Therapy Association, the APTA, emphasizes that physical therapists are real doctors who are qualified to examine, diagnose, and treat patients. Under the careful observation of a physical therapist, the chances of someone's pain and associated problems going away drastically increase. Also, the rapport between the physical therapist and the patient makes it to where if the patient's problems change, the physical therapist can immediately change the plan of care, which means that the physical therapist can directly target the symptoms. This is a superior form of combating pain rather than just trying to jump from one medication to another. Not only does physical therapy target and heal a problem, but also impacts overall health. Prescription opioids and other over-the-counter medications may solve the problem most people seek medication for, which is pain, but physical therapy does more. It's preventative and improves overall health. According to Burke.org, the website for the Burke Rehabilitation Hospital in New York, physical therapy can provide the condensed list of benefits. It can help someone avoid surgery, improve mobility, recover from a stroke, recover from or prevent a sports injury, improve balance and prevent falls, manage diabetes and vascular conditions, manage age-related issues, manage heart and lung disease, manage women's health and other conditions, and most importantly, physical therapy can help reduce or eliminate pain. Half of this short list of benefits are preventative measures. A strong example of how physical therapy impacts overall health is through the findings of a study called The Effect of Psychomotor Physical Therapy on Health-Related Quality of Life, Pain, Coping, Self-Esteem, and Social Support. The study examined the biopsychosocial effects of a certain type of physical therapy called NPMP. You can read that. The aim of the study was to assess the effects of a 6-month intervention of NPMP on health-related quality of life and on pain. And after the 6-month intervention, the study found that there was a significant difference between the groups who had received the physical therapy and those who did not receive it. The study demonstrated that with the aid of physical therapy, health-related quality of life can greatly improve. Lastly, one of the most compelling reasons why physical therapy should be prescribed prior to medication is because it is not addictive. The opioid epidemic has really gained popularity the past few years, and because of this, in March 2016, the CDC released the CDC guideline for prescribing opioids for chronic pain. In this, the CDC states that opioid pain medication use presents serious risks, including overdose and opioid use disorder. Also, in the 2018 Oxford article, Balancing the Risks and Benefits of Opioid Therapy for Patients with Chronic Non-Malignant Pain, Have We Gone Too Far, Not Far Enough?, the author states that individuals on a higher dosing of long-term opioids typically have concomitant psychiatric disorders and substance use disorders. The APTA has even begun a movement in favor of choosing physical therapy over opioids, and it's called Choose PT. The APTA states, when it comes to your health, you have a choice. Choose movement and better health. Choose physical therapy. The breadth and benefits of physical therapy outweigh the potential risks of opioids and medications. Because of this, I want you to understand that physical therapy is a great alternative for managing pain and that it should be prescribed before medication. So next time you struggle with a chronic pain, I avoid you to urge medication that only masks the pain, and seek physical therapy because physical therapy can target the true problem.